Um, right. I'm sure that that overlay could happen. I'm sure that that data is available on a geographic basis, and so it would be an interesting analysis. We know from the field that people are having to make hard choices between do I, buy food, do I pay for rent? Michelle, hi.
Rebecca, I'm sorry, can you bring her the mic if she's in it? Otherwise, remember, we're recording. We're recording. We're not going to capture it.
Oh, I have to be recorded. So I won't look at the camera. So the food bank, I'm Michelle Garcilaso. For those who don't know me, I work at the SF Marin Food Bank. And we actually have a pantry at Linwood Elementary School. So to answer the gentleman's question, I think one of the things is that it has a high percentage of free and reduced lunch rate students that attend that school. I don't have the number offhand, but I would definitely say it's probably over 60% free and reduced lunch rate. And then also, just Googling on my phone, Deer Island, that's northern Novato area, and we, the food bank, have also been looking at northern Novato as well, because there have been quite a number of calls from staff at Olive Elementary saying that they do have a fair number of kids that whose families are struggling to provide healthy food. And I think their free and reduced lunch rate is probably something like 30 to 40%, but don't quote me on those numbers. So it's a relatively high poverty in those two areas.
I'm going to say something that's shocking, but I'm the school nurse at Linwood. So I am always trying to help the families make sure they're not food insecure. And the food bank does come there once a week. And the custodian ends up having to throw the food out. And I'm not sure why. It's not that we're not telling them. I'm just not sure. Kids will tell me that they don't have food at home because I always ask them. And I call the parents immediately through an interpreter or whatever it takes to communicate that this food is there. And it's healthy food. It's wonderful food. So that's an issue that needs to be addressed.
Okay, so it sounds like I want to be careful here because we're starting to get into small group dialogue. Let's stop this conversation. I'm sure you two can talk offline about this. Rebecca, I'm going to pull you back up. If you can finish your presentation, because I want to get Pam's presentation and I want to get you in small groups. So if you could maybe move through the rest of it, and I'm going to be a bit
We've
of
got our
a
taskmaster
taskmaster.
here. That's great. We all need one. Okay, so that's all I had in terms of data that I wanted to share, but what I wanted to do now is to just share a little bit about the HEAL approach. We're really trying to build an approach countywide that's more coordinated, more collective, with a countywide focus. We have 3 implementation teams through HEAL. We have the Marin Food Policy Council, we have the HEAL Active Living Team, and we have the Children and Youth Wellness Collaborative. The Active Living Team has some upcoming opportunities that we want you all to be aware of as opportunities for Novato to link with. The group is trying to explore the status of shared use agreements around the county and best practices. We know that the Hamilton Gym is a great example of that partnership between the school district and the city, and looking for more of what is happening around the county, how to promote that kind of shared use to promote physical activity. We, as a team, applied for a mini grant from Parks and Open Space and have been really building that relationship with Parks and Open Space with the Measure A funding to develop community ambassadors for physical activity and to have some transportation opportunities available for communities to get out to parks that don't normally have that opportunity. And we're going to be doing a walking group leadership ambassador training for folks that are really interested in becoming walking group leaders and champions in their communities. So if that's something that any of you are interested in or have folks in the community that would like to participate, please let me know and I'll Pam will have more information about that as we get a date for later this spring. The Marin Food Policy Council has been working on food systems and food policy issues in Marin. One of the things that we've done recently with the support of Bob is to be working on a model policy for community gardens to help streamline the permitting process for community gardens. It's based on some of the policy in San Francisco and Berkeley. And UC Cooperative Extension also is helping to work with municipalities to understand the model policy, to see if it can be adopted in local communities. But they're also working on a community garden management academy and ways to help build infrastructure for community gardens and school gardens across the county. We have technical assistance available around healthy food and beverage standards. Pam and I have also just been in communication with the California Center for Public Health Advocacy about doing a convening of park and rec directors across the county to be looking at healthy food and beverage standards and how to adopt them for programs. We might have some incentive money coming down the pike for organizations that want to adopt that kind of policy to get some kind of small financial incentive. And then we're doing a lot of work around CalFresh enrollment and utilization. CalFresh is what formerly known as food stamps is very underutilized in Marin County on the whole. And it's a way of promoting extending those food dollars. So I'm getting that. The Children and Youth Wellness Collaborative is the last HEAL team, and that group is really just a networking group for children and youth programs. So thank you. I'll be here for the day.
Thank you, Rebecca, for sharing the information and initiative we already done on the county level. But one of the things that we're in common here, and that's why we invited you, is we want to focus on Novato here in the city level. That's obviously good to know that all the resources are available in all the county-wide data. But really what we want to know is what are we doing here in the city of Novato? And of course, today we have Pam Sunat. She has done a lot of initiative and effort to get this started. So we want to hear from her so that she can give you an update what we are doing here in the city of Novato. She's the Director of Parks, Recreation, and Community Services here in the city. And Pam?
Thank you, Jason. Well, today's pretty thrilling for me because the city of Novato started our Healthy Eating, Active Living initiative 2 years ago. And we really had a struggle really getting it launched and getting it really moving so that we're actually having a large-scale impact. We started out, some of you may know, joining Let's Move Cities, Towns, and Counties, and that's Michelle Obama's national initiative on getting childhood obesity in kids addressed. And we started out with that, and there's 5 key areas that we need to focus on within Let's Move. And we started working on those, and they're not all within Parks and Recreation. And so interestingly, we then adopted the Heal Cities campaign, and I'll get into that in a little bit. So I'm really thrilled that you've all agreed to participate in this because it's been a long time coming from my perspective. We have key people in this room that can have large-scale impacts, and to me, that's what it's all about. It's not just individual responsibility anymore. It's got to be collective impact. And so I also have a personal interest in this because I am one of those people that has been a lifelong battle with my weight. And in order for me to be healthy and to be thin, I need to be active. And I don't have that opportunity too often. I'm a single parent with a young child. He keeps me busy, so for me, it's a personal commitment as well, not only just a professional one. And so today, as you can see up here on the slide, it's all about bringing everybody together to have the collective impact. I think I went the wrong direction. I did go the wrong direction. There we go. This slide's very telling for me. This is adult obesity, so that means the BMI is greater than or equal to 30. So for somebody that's 5'4", that's 30 pounds overweight. This is a 20-year span. So if you start up in the corner over here, 1990, that represents 10 states had obesity prevalence that's less than 10%. No states have anything over 15%. And if you go to 2010, you can see that we're getting up into the greater than 30%. So it's pretty astounding. So that's some big changes that have happened in just a short period of time. And then on this slide, one of the things that's so telling to me, having a young child myself, is that we have kids that 7.5 hours a day they spend in front of a screen. So it sometimes don't even dawn on them to go outside and be active as a normal course of their daily activity. That's 7.5 hours. That's huge time commitment being sedentary. And so inactivity and inadequate nutrition help to make this a very complex problem. Now, the food environment over the time frame here to create this obesity epidemic has actually changed quite a bit. And as you can see up there, there's increased in the number of fast food establishments. We see that everywhere. Marketing to kids is a billion-dollar industry, and it's all about unhealthy food and beverage that they're marketing to kids. And then having access. One of the things that I found interesting is less food's eaten at home. And look at that. At the top is food at home since like 1962 to early 2000s, and food away from home. And the other piece that's interesting on this slide is the food at home isn't necessarily stuff that you're making from scratch. It's, convenience is the lifestyle that we've got now. And so when you go out, it's fast food a lot of times, or it's food where, for a child, for example, they eat almost 2.5 times more calories, almost 2 times as many calories when they go out to eat as they do if they eat at home. And then when you're eating at home, you're not necessarily making food from scratch and using healthy food options when you do that. Sorry, I keep pushing it the wrong direction. So as just to reiterate what Rebecca was saying earlier, of making the healthy choice the easy choice, and by that we mean safe, convenient, something you can build into your everyday life, has got to be what we focus on. Because interestingly, and you can see that up here, leisure time's really not decreased over this time frame that the obesity epidemic's been developed. It's actually stayed about the same, but it's our active daily routines, like walking and biking to school, or walking and biking to the grocery store, or over to a friend's house. That has changed quite significantly. So the Center for Disease Control recommends a number of different behaviors to target in order to address the obesity epidemic. And there are 6 of them up there, but I'm not going to touch on every single one of them. You're here to talk about all those today. Whether it's breastfeeding or consumption of fruit and vegetables, these are the topic areas that can really have an impact, and all of you represent one of these areas or more. So what needs to be done? I kind of grouped this into 5 different categories. For the purposes of the city, we're focused on what's called a Heal Cities campaign initiative. And so what that involves is that we adopted a resolution of commitment, and it's focused on 3 areas. And you can see 3 of them up there. So the built environment, well, what does that mean? That means the infrastructure in our community, so sidewalks, pathways, safe bike paths. So you're really building an environment that caters to seniors, youth, and the disabled. That is the foundation. And then employee wellness, that's another piece that's a critical part of our commitment. And that could be within our own organization, because we don't have a very robust employee wellness program. But it also can be working with other organizations in Novato to do it collaboratively, so that we're both benefiting from developing some good core employee wellness programs. And then the third is healthy food access, and you've heard a little bit about that already today. But in our case, in Parks and Recreation, we serve over 100,000 people in a year. Some of them, but many of them are repeat customers. And we operate community centers that see 50,000 people come through them in a year. So we can play a pretty critical role in making sure that there's healthy food available in the vending machines, that there's no sugar-sweetened beverages provided through our camp programs, other than stuff that is healthy for them. So water always being an access for them. And then the other 2 areas up here are schools and partnership. Because if you know the nutrition director for Novato Unified School District, he is one of the champions of healthy food access and healthy food in the county and in the Bay Area. And so we're fortunate here in our schools that our students do have access to very healthy food, and there's a lot of other things going on that he's a champion about, so we're thrilled about that. And of course, partnerships, and that's why we're here today, because some of the things that you might be doing, others can help with. And so I put community design elements up here, just kind of as a food for thought before you go into your discussions today. But creating the village concept so that you don't have to drive 5 miles to get to a grocery store. So that walking to school, you can be out of the drive aisle and you're on a safe sidewalk or in a safe bike path. So those are some of the things that can help to stimulate daily activity. That's the point, daily activity. So that you have to do some kind of physical activity every single day to do your daily life skills. And then one of the things that we're hoping to get from you and help with is how do we create this culture of healthy, active living so it's pervasive, so that everybody is tuned into it, so that every choice that we make, like in our case, if we operate a licensed child care center at Lou Sutton, are we making sure that they have access to water all day, that they have healthy food when we serve snacks, and that we educate the parents so that they're doing that also at home with them? And so we're going to be starting in Novato on the updated general plan you heard earlier. But that's the planning document that drives the next 20 years of Novato. Now, granted, there's not a whole lot of places to build, but if you take that down to a lower level, anytime we put together any kind of a project, whether it's we renovate a park, or the school does some renovations at a middle school, or there's a project, retail development or commercial development, we need to be looking at the physical activity focus. So does it connect well to a sidewalk? Can somebody that's disabled or a senior or a kid riding on a bike safely get to and from it? And then when you're in it, depending on what size development it is, how easy is it to get around? Does it motivate physical activity? And then the other thing that we're doing in Parks and Recreation is when we renovate parks and we look at our recreation facilities, we're starting to have that health in all projects focus. So we're looking at how can we improve people's health by the way we design our parks. Okay, so that can be pathways, that can be connection to the sidewalks, other ways to connect. And then, of course, the Center for Disease Control recommends a number of different things that you can do around healthy food and physical activity. And so I'm not going to address all of them today. You do have, if you picked up the little colored handout over there, copies of these slides that can help inform or influence your discussion this afternoon. And they also have strategies around physical activity, and I mentioned some of them already. So what are we already doing? Well, I said we've adopted a resolution of commitment around healthy eating and active living. And so we've joined other cities in California around that to focus on the 3 areas that are up on the slide. The built environment, so we're going to be looking very heavily at the bicycle and pedestrian master plan that the city's updating and the general plan. And our recreation commissions made some recommendations to our general plan around health and physical activity already. Some of the other things we've done up here, some of the schools we've started with it says BU up there. Well, what that means is building, educating, exercising. And it's a program that has homework help, but it also has a vigorous physical activity component because we've trained our staff in something called Spark After School. And then it also has a character development, self-esteem enhancement program. So we're kind of rolling it all into one program. And we use a program for that called Positive Action. So the staff were specifically trained to work in this area. It's an after-school activity, after-school program. And the City Council has fortunately funded it this year, and we've managed to get into 2 schools, and we're hoping to double our numbers of schools that we get involved in. And so that's an exciting program that the kids and the parents are thrilled about. And then we've recently created, now you have some of our recreation commissioners here, to help drive the action plan that's developed from this group forward. And so we put 2 ad hoc committees, so they're working committees together to work on, one is on the Healthy Eating Initiative, Healthy Eating Active Living, and the other is on that Let's Move Cities and Towns so that we achieve our goals in 5 areas that are part of that program. And both of those programs overlap. Now, opportunities. Many of these have been mentioned, but I'm going to mention a few more that are up here. Hill Recreation Area Master Plan. If any of you are familiar with where that is, it's next to Margaretide Senior Center, it's next to the Hill Education Center, and it's next to one of our gymnasiums. And so it's acres and acres that we currently use for athletics, for sports activities. But we're getting ready to master plan it. And so some of the focus is going to be how much intensity can we get into this for physical activity? How can we make it connect to the neighborhoods so that people can walk to the site instead of having to park everybody there? And so we're really going to look at that coming up. Another one that's exciting, for me anyway, is the Stafford Lake Park Master Plan. So that's just outside of the city limits, and it connects by an asphalt path to get to it. And they're building a bike park starting this summer. They're starting the first phase of a bike park, which is exciting because it's going to be a great physical activity area for kids as well as adults. And we're going to hopefully inform the development of Stafford Lake Park as part of this master plan. So I'm telling you that so that if you're a resident here and you have an interest in seeing that park developed in a way that supports healthy eating and active living, that you participate in that.
Can I just say that Bell Helmets right
Yeah.
now has
Thank you.
a voting possibility for, thank you. Bell Helmets has said that they're going to give out $100,000 to the bike park that gets the most votes. And Stafford Lake is neck and neck with another park in California or in the western region. And so I want to really encourage everybody here to put it on your Facebook, send it out in your emails. And if I can get a link, I mean, there's basically, if you go to Bell Helmets, you'll find a link for this. And it could be $100,000 in the pocket of Novato for getting this going.
There's also probably a link at staffordlakebikepark.com that you can find that. Yeah. Yep. All right, so the only other one I want to point out on here is the pickleball courts. And I think that's a funny thing to be bringing up, but we are already working towards adding pickleball courts, which is another intensely physical activity, but it's right now very attractive to the 50-plus age group, but it can be played by anybody, any ages. So it's something we're hoping to keep tuned into. And then more opportunities. I'm just briefly going to touch on some of these. But right now, the Agricultural Institute of Marin is doing a feasibility study on a mobile farmers market. And so they're meeting with stakeholder groups to find out what's already happening, like where the food bank is, where other farmers market activity is happening in Novato, and seeing if there's any gap or need for a mobile farmers market. And so those conversations have already begun. And then at the bottom here on this slide, and if you see the copy, it's actually called Active Alliance. It's Dr. Oz's health core thing focused on high schools. They bring a health core coordinator into a campus who then is a teen who then does nutrition education, physical activity education, and different things in an effort to make teens healthier and more aware. So for today, our vision here simply is Novato has healthy, active people and an abundance of safe places to play, be active, and connect. And so from you, we're looking for your ideas about how to make Novato healthier, how to make it a very active, friendly community, because you represent different things. And so what can you do to help? Participate today, and then participate in our next workshop. And if you have any thoughts in between time, or you have collaborations you want to suggest, please do that as part of this effort. And so this was a handout, and Kathy referred to it a little bit earlier, but it reinforces what our already HEAL commitment has been from the city. And so the theme areas on the bottom are areas that you should talk about and we're going to discuss when you get into your small groups. And so for today, I'd like to thank you for participating and thank you for making life great in Novato. I mean, I really have high hopes for what comes out of this being a document and a course for where we can go. So thank you for informing our activities in the coming years.
Good morning, everybody. Can you hear me?
A little closer, Gary.
Can you hear me now? How's everybody? Thanks for everybody coming out this morning. My name's Gary Apelces. I'm an integrative nutritionist. I do a lot of work with organizations and communities around healthy eating, physical activity, and a lot of work with childhood obesity and diabetes prevention. What we're going to get started doing in a little bit is we're going to break you out into your groups to have some discussion. But to start, we want to talk about what does a healthy Novato look like in the year 2025. And Maria is going to walk around and kind of get some ideas from some of you. If you want to just raise your hands and let us know. Pam said some great things in what she was talking about. We talked about partnerships with other organizations, other community partners who have as your strengths their weaknesses. And that helps to bridge some gaps. You, everybody in this room who came out today, you are the village that it's going to take to build a healthier community. So what we're really looking for is to start getting some ideas and start getting this process down on paper. So what does a healthy Novato look like to you in the year 2025? If you want to stand up. And
Brian
introduce
Garbett.
yourself.
I just want to say, like, when I visit Palo Alto, there are bike lanes on the city streets all over town. And that really encourages people to get on their bikes and go places, whether it's to go to work or go visit friends or whatever, get on the bicycle. In Novato, I ride bikes a lot, and it's dodging through traffic half the time because there aren't enough bike lanes. That would be helpful.
Great. Next.
I've had a long-standing dream of having a really active, plentiful production garden in every Novato school, and the community gardens. So community gardens and school gardens go hand in hand. So churches, schools, vacant lots, the Novato community garden that's currently in the works, having this community of gardens that actually feeds our children in the schools. And, you know, the Indian Valley Farm is part of that, and we are acting as a consultant to help people do that. And I'm working with Linwood Elementary and Hamilton Elementary to get their school gardens to be more robust. But we really could feed all of our kids in Novato with all of our school gardens and the Indian Valley Organic Farm. And it would be a great, healthy community activity.
Great, thank you. And we just want to keep these to short little snippets because we're going to break out into our groups in a couple of minutes, and we're going to make these get even into bigger, longer discussion about it. So if we can just keep these kind of on the short side because we only have about 10 minutes for this section.
Hi, what a healthy Novato would look like to me would be that there would be no difference in health between the low-income population and populations of higher socioeconomic means. So that would be awesome.
Great. Thank you. I think Bob, did you have something, Bob?
I'd like to see every child have a safe route to school. That includes not just the bike lanes, but sidewalks, pathways, and especially a safe way to cross the street. And that safety takes some precedence over the need for parking.
Thank you.
Thank you. Anyone else? Right in front.
I would love to see us having outlets to buy groceries, at least small facilities that are either walkable or bikeable in every neighborhood, and then we actually support those businesses instead of the large corporate.
Thank you.
I'd love to see a culture of Novato where walking and biking becomes the standard and the norm, and so when you come in your car, you feel a little bit weird, much like you would feel smoking in a restaurant now.
There really needs to be some work on culture change so that people appreciate good, healthy food. And if you look at the map and see the locations of all the fast food restaurants and how hard people work and commute, 60% of the people who live here are commuting out of the area every day to work, and 60% of us who work here are coming in from another place. It's a lot easier to go to a fast food restaurant for dinner when you get home at 6 o'clock at night than it is to prepare food. So then it really needs to be a culture change. And as the school nurse alluded to, you can have lots of healthy food sitting around for people to pick up and use, but if they don't know how to use it, or if they don't appreciate it or like it, they're not going to use it. So we need a cultural change around food.
I would like to see, hi, I'm Mickey Peterson from the Y. I would like to see a culture of collaboration so that we as people of the community have an opportunity to work together and figure out what the gaps are and partner together versus working in silos.
I just wanted to say that our Marin County Fair every year, it's known to be the greenest fair in the United States. And there's health ambassadors there that promote healthy eating and active living, and it's a smoke-free fair. And I just wanted to plug that in. Okay. Anybody else?
Anybody else? Right up front.
Yes, I don't live in Novato. I live in Rohnert Park, and I used to live in Novato many years ago. And the reason why I moved to Rohnert Park is because they built the city with parks. Every section of Rohnert Park has a park, a swimming pool, sidewalks from the, like I live in a court. There was a sidewalk to the street for the kids. The whole city, it was built, in community. So I work in Novato. I've been working in Novato for 25 years, and I live here. But I don't know if it's possible at this time because the city is already built. But it is any new neighborhood, they should plan in the neighborhood a park, and just anything new or anything that could be adjusted so the kids have access in their bikes to go to school. So anything to build this, trying to rebuild this city friendly for kids and and adults to walk, like you said, have sidewalks, and that's what I would dream, even though I don't live here, this is what I work, and my family lives here. Thank you.
In the back.
I think this goes along, and this may be what you were talking about, Bob, but I'm not positive if this is what you were alluding to, that there's a really wonderful model out there for like liquor outlets and places like 7-Eleven type stores to actually start serving or having available healthy choices besides the alcohol, but including healthy food choices. And so I'm not sure if that's the model you were talking about, but it is a wonderful one that's out there.
So access to healthy food in our food deserts and in communities that don't have that access.
Thank you.
And I would like to add affordable healthy food wherever we have healthy food, because we have healthy food, but it's not always affordable. But my vision in 2025 is that our youth, the peer pressure and the culture shifts in such a way that peer pressure is towards healthy choices.
Thank you.
Thank you. Anybody else have any comment before we start getting broken up into your groups?
Okay. Thank you.
All right, well, we're going to get you started and broken up into your groups, and we're going to have 3 common things that we're going to talk about in our groups as you go into them. They're going to be...
Sorry, right behind you. We'll reference sheet.
Great. So I'll come over here so you can hear me. So we're going to have 3 groups. We have group 1, which is going to be led by Mickey and Jason. And that's going to be personal wellness and employee wellness. Group 2 is going to be led by, thank you. Group 2 will be led by myself and Leslie, and we're going to talk about healthy food culture and healthy food access. And group 3 is going to be led by Maria and Kathy, and that's going to talk about capacity building and built environment. Now, we strategically broke you up into groups, so you may not actually have a background in some of those areas, but we want everybody to kind of get an idea of different things. So there will be some people in your group who have great information to lend. You might actually have some thoughts and ideas that you've never had a chance to speak about, so we're going to kind of get you all together, and we're going to have some great discussions. And then we're all going to come back and kind of wrap it up and conclude. Do you want? Yeah. So, team 1, again, Mickey and Jason in the back over there. That's going to be Bob Brown, Leslie Benjamin, Rebecca Smith, Mary Sturbridge, Heather Sober, Jenny Party, Nancy Weber, and Bill Klein. So if you guys want to move over to that direction. Team number 2, which is going to be with myself and Leslie, is going to be Linda Jackson. If I screw up your name, I apologize. Linda Jackson, Corrine Malrath, Teresa Shemi, Susan Juilliard, Paula Nessie, Jane Johnson, Kim, Anna Ortiz, and Michelle. Okay. I'm not Italian, sorry. And team 3 is Rebecca Marwick, Marianne Shinsky, Dr. Cunningham, Lori Watson. Is that right? Oh, Liz Watson, I'm sorry. Liz, hi. Brian Garbett, Wendy Catlins, Gail Howard, and Jeanette Longton. Have we missed anybody? Did everybody get a group? Okay, we're going to take a... No?
So go ahead, find your group. If you want to grab some food, if you've got to go to the restroom, but we're going to sit down and start working. Because again, I want to be respectful of folks' time, and I think you'd rather work through and be able to get out of here sooner. So go ahead and get set up, grab some food, go to the bathroom, but we're going to start in about 3 minutes.